Hello everyone, let's label together the blank figures of the pelvis and the hip bone. This is the sacrum. The sacrum is the posterior part of the pelvis. Inferior to it, we have the coccyx. This is the coxal bone. We have two coxal bone, also called the ossa coxae, also called the hip bones. So we have two hip bones that articulates with the sacrum. This is the base of the sacrum. This is the sacral promontory. This is the sacroiliac joint. So we have two sacroiliac joints. This is the ilium. So the sacrum articulates with the ilium, which is part of the hip bone. We also have the pubis right here on the superior and anterior aspect of the pelvis, and we have the ischium on the inferior and posterior aspect of the pelvis. This is the iliac crest, one of the structures on the ilium. The hip bone is the result of the fusion of the ilium, pubis, and ischium. This is the pelvic brim. This is the interior aspect of the pelvis cavity where we have all the reproductive organ, the urinary bladder. This is the ischial spine, which is part of the ischium. This is the acetabulum, which is on the lateral aspect of the hip bone. It receives the head of the femur, the bone in the thigh. This forms the hip joint. This is the pubic tubercle, which is part of the pubis. And this right here is the pubic symphysis, which is a fibrocartilage disc. This right here is the pubic arch. Moving to the anatomy of the hip bone, let's start first with this figure. This is the ilium. This is the ischium. And this is the pubis. The ischium is on the posterior aspect. We sit on the ischium. The pubis is on the anterior aspect. We have the pubic symphysis anteriorly. So these two bones will help you identify the anterior versus the posterior aspect. This is the ala of the ilium, whereas this is the acetabulum. We can see the fusion of the three bones in the acetabulum. The acetabulum will help you identify the lateral aspect. Keep in mind that the acetabulum receives the head of the femur. This forms the hip joint. So the acetabulum will always face laterally. Medially, you have the internal organs, such as the urinary bladder, the ovaries, the uterus, all the reproductive organs. This is the iliac crest. This is the anterior superior iliac spine, whereas this is the anterior inferior iliac spine. Both are anteriorly because the pubis will help you identify the anterior aspect. One is superior and one is inferior. This is the tubercle of the iliac crest. This is the posterior superior iliac spine. This is the posterior inferior iliac spine. Both are posterior. The ischium will help you identify the posterior aspect. One is superior and one is inferior. This is the posterior gluteal line where the gluteal muscles are attached. This is the anterior gluteal line. And this is the inferior gluteal line. This right here is the greater sciatic notch. It looks like an S. Keep in mind that the greater sciatic notch is part of the ilium. This is the lesser sciatic notch, which is part of the ischium. So you have a bigger one and you have a smaller one. The greater versus the lesser sciatic notch. This is the ischial body. This is the ischial spine. The ischial spine separates the greater sciatic notch from the lesser sciatic notch. This is the ischial tuberosity. This is the ischial ramus. Ramus is like an arm-like projection. This is the pubic body. And this is the inferior pubic ramus. We have one ischial ramus, whereas in the pubis we have two pubic ramus. One is superior and one is inferior. In that view, we can only see the inferior pubic ramus. Moving to this aspect, notice how the acetabulum, because it faces lateral, here we can't see the acetabulum. So this is the medial aspect of the bone. There's a new structure right here we can see posteriorly. First, this is the iliac fossa on the ilium. This is the posterior superior iliac spine. As we mentioned, the ischium will help you identify the posterior aspect. This is the posterior inferior iliac spine. Whereas this is the anterior superior iliac spine. The pubis will help you identify the anterior aspect. The pubis in red right here. And this is the anterior inferior iliac spine. One is superior, one is inferior. Both are posterior, both are anterior. This is the auricular surface. The sacrum articulates with the pelvic bone via the auricular surface. So the auricular surface will help you identify also the posterior aspect, because the sacrum is located posteriorly in the pelvis. This is the arcuate line. This right here is the ischium bone. This is the ischial spine. This is the ischial ramus. As we mentioned previously, we only have one ischial ramus. We also mentioned that the ischial spine separates the greater sciatic notch from the lesser sciatic notch. This is the pubis in red. This is the superior pubic ramus. This is the pubic tubercle. This is the pubic crest. This is the inferior pubic ramus. So we have two ramus for the pubic bone. And this right here is the articular surface of the pubis.